Hello everyone, so let me just check, am I audible, is the screen clear so that we can start the session. This is the session of muscles of forearm. That is the second part of the session which we are going to discuss now. Okay, so am I audible and is the screen clear so that we can go up with the session now. Let me just have a look on this. Okay, so yes, I am audible and everything is fine. Great. So we can start the session. Everything is fine and I am audible. Yeah. So let me tell you about myself and then we can start the session. Dr. Monalisa, MD Anatomy from Forces Medical College Pune. I am here to discuss the important muscles of the forearm. The second part of it already covered up the first part, and I have got a total of 9 years of teaching experience for the competitive exam for various examination in the medical fields. Special class features, when I am talking about the special class, it's in this you can get an benefit of an interactive sessions, live classes. Polls are conducted, the learners can participate in the poll and it will be highly beneficial. You can raise your hands and get your doubts clear right itself jab session ja raha hai. So at that time you can have your doubts clear, never ever miss a session. Lecture notes and PDFs can be downloaded anytime, anywhere. Read from the top educators of Unacademy platform. So these are the benefits of special class, and definitely you can be the part of this special free platform by using the code ANAT10. By using the code ANAT10. So my dear aspirants, do join by using this code and be present for the free special sessions. I would like to share a very important information with you all. So those students who want to prepare for the next examination, they should be definitely be present for my NEET PG strategies and the MCQ session of 100 MCQs. So I am going to take 100 MCQ session. That is very important, 100 MCQs on Thursday, Friday and Saturday. Definitely you should be present for 6 p.m, 7 p.m, 6 p.m, 7 p.m, 6 p.m, 7 p.m. So see here, the sessions will be on YouTube, Unacademy, YouTube, Unacademy, YouTube and Unacademy. So how 3 sessions, the timing will be fixed for you. The session 6 p.m. will be on the Let's Crack NEET PG YouTube channel. Let's Crack NEET PG YouTube channel, Unacademy free platform 7 p.m. So this is how each day we will take on 3 days, and so that will be highly beneficial for you, Thursday, Friday and Saturday. So do join and present on the live session. So I will tell the students and the aspirants to do present live for the session. It will be an interactive session. You can ask your doubts live itself when the session is going on, so that you can get a maximum benefit from this session, and you can utilize your precious time in the right manner. I also want to tell the aspirants that those who have not downloaded the Unacademy app, go for it, download the Unacademy app, find your goal as NEET PG and use the code ANAT10 to get an access to free session taken by the top educators of Unacademy platform. So go for it, my dear aspirants. And my dear aspirants, I would also like to share this. Let me enlarge it. This is the NEET PG free test calendar, and this NEET PG free test calendar can be utilized by you. So thus use this code and do present for this session. Highly beneficial for you. Highly beneficial for you, my dear aspirants. Okay, the entire session detail till 12th March is discussed with you. Okay, now plus subscription. So when I am talking about the plus subscription, all 19 subjects are completed in a very systematic way, so that you can get a better rank in the competitive exam. You can study from top educators, you can compete in live tests and quizzes, you can study on the device of your choice, you can have an access to 25,000 MCQs. And my dear aspirant, these MCQs are high yield MCQs, clinical MCQs of all 19 subjects made by the top educators of Unacademy platform and given an explanation for each and every MCQ. So you can just have the benefit of joining this session. Yes, Mr. Ravi Kumar, hello dear. So iconic subscription, when I am talking about iconic subscription, you can have an access to both Unacademy and Prep Ladder. You get the benefits of the Unacademy Plus course. Along with it, you also get the benefits of the Prep Ladder. That means well recorded live batches, recorded sessions will be catered by you. You will also have the Q Band 25,000 MCQs, competitive test and live quizzes. Along with it, you get the benefits of the Prep Ladder. You get the notes of the dream faculties and the team of the Prep Ladder, the rapid revision snapshots, the printed notes of the Prep Ladder, the video lectures and the recorded version of all Prep Ladder educators videos. So that all things, that means you get an access of best of the two platforms. So go for go for this subscription, Iconic subscription. Use this code ANAT10 and get 10% discount, extra discount. Now I would like to congratulate the toppers of I want to congratulate the topper of FMG December session. I wish them best of luck so that they can target their competitive exam with a very good rank. All the best, my dear aspirants. Now, I would also like to tell you the information of the batches which is starting today. That is the Focus FMG 2022 batch is there, the Miss and INI CT batch 2022 batch, NEET PG 22 High Yield MCQ Marathon batch, the NEET PG 22 All Educator Revision batch. So my dear aspirants, go for it. Use the code, my code ANAT10 and get an extra discount of 10%. The pricing detail. So have a comparison on the pricing detail of Iconic and Plus, which will help you to decide whether you should go for Plus or Iconic subscription. Students of first and second year, so definitely go for 3 or 4 years of subscription of Iconic. They will target their next exam with a better rank and also their university exam. Boost your medical preparation by taking the subscription. Students of final year and interns can go for 1 or 2 years of subscription. Use my code with which will provide you an extra discount of 10%. Boost your medical preparation and get an additional benefits of these months which is valid till today. Till today it is valid. So go for it. Boost your medical preparation, dear. Now let's start with the muscles of forearm. Now my dear aspirants, we have already covered the topic of the muscles of anterior aspect of arm study session. Now today's session is the muscle lying on the forearm back muscle. So that is the session which I want you to explain. So actually if I categorize the muscle, if I categorize the whole muscle which is lying on the extensor compartment of forearm. In forearm we have got 2 compartments. The anterior compartment is called as the flexor one and the posterior compartment is called as the extensor compartment. So already we have covered up with the forearm flexor compartment. Now today's is the back muscle. Okay. So yes, definitely. So let me complete it. Definitely Mr. Ravi Kumar, radiology in FMC. I wish you best of luck. Definitely you will target it. So let's complete the muscles first. So and definitely if I want the students of first and second year, those who want to study from the basics, would definitely go for the sessions which is taken by me, the theory sessions on the Future Doctor Unacademy Future Doctor. Otherwise, the students who have got a competitive approach, they want to complete the entire 19 subject in a less span of time, they could follow me on the Let's Crack NEET PG platform on Unacademy platform. So definitely I am coming up with the 100 MCQs session tomorrow, day after tomorrow, and yeah, that is on Thursday, Friday and Saturday, 6 PM, 7 PM session, YouTube. Let's Crack NEET PG on Unacademy special class. So that will help you, my dear Ravi. So God bless you and all the best. Definitely you will get radiology. Now let's focus on the topic because many of the students, time is important. So let's focus on our targeted topic, that is muscles of forearm. So today's session we are going to cover up the muscles of back of forearm. Okay. So when I am talking about the muscles of back of forearm, it can be categorized as superficial group and deep group. So superficial, firstly let me tell you about the superficial group of the back muscles. So in this category we will have the following muscle. So my dear aspirants, in this category actually what happens, the muscles can be categorized as the lateral group and the posterior group. Again, as we know, all of the muscles of back is lying in the posterior group, that is the extensor compartment. But if I want to categorize into two format, one is the lateral posterior aspect and one is the posterior aspect. So that would be Brachioradialis, okay, Extensor, carpi, radialis longus, okay, ECRL in short form, and Extensor, carpi, radialis brevis in short form, it is ECRB. So please note down these 3 muscles. If I only talk about these 3 muscles is categorized to be lateral superior group of posterior muscle. So muscles on the extensor compartment, in this category these 3 muscles are categorized as the muscles lying in the lateral group muscle. Exactly, posterior muscle of superficial group or posterior back muscle, these are the following muscles. So write down the name: extensor digitorum, extensor digiti, minimi, EDM in short form, ED for extensor digitorum, and extensor carpi ulnaris. One more small muscle, that is Anconeus muscle. So this is ECU in short form. So these 4 muscles, if I talk about these 4 muscles or these 4 muscles, these 4 together muscles are more lying in the posterior group of back muscle, posterior group of back muscle. So these are the list of the muscles of the extensor compartment of forearm. Now let's talk about the muscles of the extensor aspect of forearm in the deeper aspects, in the deeper aspect. So in the deeper after dissecting the superficial muscle, when we approach on the more deeper aspect, we will get the deep muscles. Okay, just when you remove the layers of superficial muscle, in that deeper aspect you will have the deeper muscle. Okay, now let's focus on that. So muscles on the back of the forearm and extensor aspect of the forearm in the deeper group, we have got following muscles. So these muscles are, so please write down, these muscles are supinator, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus muscle, extensor pollicis longus muscle, and that of extensor indicis, extensor indicis. These are the 5 muscle which is lying on the deeper aspect of the back muscle or the forearm muscle. These are the 5 muscle. In short form, you can write these muscles like APL, EPB, extensor pollicis brevis, extensor pollicis longus, and EI for extensor indicis. Already we have done with the flexor and extensor retinaculum, and we have seen the compartment and the muscle traversing through each compartment of extensor compartment. We are knowing that. Now my dear aspirants, if I talk about the superficial group of muscle, they are arising from the lateral epicondyle, that is the common extensor origin. So before that, let me just show you the muscle. So let me just enlarge this. So when I am enlarging this image, you can see all the superficial. So in this diagram, you can see the superficial group of back muscle or extensor compartment. So the muscles, as you can see here, are the following: brachioradialis, extensor carpi radialis, longus and brevis. The different color has been used and you can clearly mark this: extensor digitorum, digiti minimi, extensor carpi ulnaris and Anconeus. So all these muscles which has been shown you together is constituting the muscles of the back of forearm, that is the extensor, superficial extensor group of the muscles on the back of forearm. Okay, one important point I want to add on here, I want to add on here, that all the 7 extensor muscles, so together there are 7 extensor muscles, as we know: brachioradialis, extensor carpi radialis, longus and brevis and longus, digitorum, minimus, ulnaris and that of Anconeus. So together how many? So all these 7 muscle crosses the elbow joint. All these 7 muscle is crossing the elbow joint. And if I talk about the 4 of this muscle, so 4 category of this muscle. So if I talk about the 4 muscle of this category, that is ECRB, extensor digiti, extensor digitorum, so extensor digiti minimi and extensor carpi ulnaris. So please note down, if I talk about these 4 muscles, mnemonic, don't worry. So extensor carpi, see here, these muscles, that is these 4 muscles, when I am talking about these 4 muscles, that is these 4 muscles, when I am talking about these 4 muscles, these all 4 muscles is having origin from common extensor. These muscles are having origin common extensor origins, common extensor origin. Okay, so my dear aspirants, the thing is that we will conceptually understand the origin insertion, okay, because now no one is going to ask such an easy question that name of the muscles of extensor group. They will ask identification. The standard of exams are increasing. It is more of image based and cadaveric images and also related with clinical MCQs. So the what is seen in the recent pattern of examination and in the competitive exam, they want you to identify the muscle. So many of the students tell me, ma'am, itna list of muscles hai, so many muscles are there, how we are going to memorize each and every muscle location, origin, insertion. This can be memorized once you go through seeing this muscle attachment by seeing a very relevant diagrams, okay. So that will give you an idea and by the name you can identify. So when I will show you many relevance diagrams and correlate with the name and the location, it becomes easy for you to identify the muscle. So we will not go just by memorizing the name. Now the MCQ is not just about memorizing the name, it is about identification, it is about location, it is about action nerve supply. So you have to identify in the image. That means a precise knowledge and number of images to be seen and so many times to be seen that you are not going to miss any of cadaveric image MCQs or any of the image based MCQ. Okay, my dear aspirants. So this was the superficial group. Now I would like to show one more diagram in which you can identify the superficial group of muscles. So more of images will give you a better idea. So see here. So see here also you can clearly identify the superficial layer of the muscles of the posterior extensor compartment of forearm. The muscles has been shown here, and as I told you, the seven muscles, brachioradialis, extensor carpi radialis brevis and extensor carpi radialis longus, the three lateral one. Next to it is extensor digiti, minimi, extensor carpi ulnaris and digitorum and Anconeus. So see here, this is how and you can correlate, okay. Now muscles on the back of forearm, when I am talking about muscles of back of forearm, the deeper group, the deeper muscles of the back of the forearm. In this category we have got just 5 of it, so 12 muscles. So that means a total of 12 muscles are there, 7 in the superficial group and 5 in the deeper aspect. The muscles are supinator, abductor pollicis longus, extensor pollicis, we have got supinator, abductor pollicis longus, extensor pollicis brevis and longus both and extensor indicis, which is shown by the beautiful diagram with a correct correlation of the image and the color coding, so you can correlate. These are the muscles. So more of the deeper muscles as going towards the thumb and one is going towards the index finger. So this is the another diagram where you can appreciate the deeper muscles of the posterior compartment of the forearm. Has been shown with different color. You can see here very nicely the supinator muscle. This is the supinator muscle. You can see here the extensor pollicis brevis and extensor pollicis brevis and abductor pollicis longus along with extensor pollicis longus. So all these are, you can see the word pollicis means going towards the thumb. That means these 3 muscles are going towards the thumb, and we have got the other one, that is extensor indicis. EI going towards the index finger, that is indicis. Got it? Now before moving on to the individual muscle and explaining you, I would like to show you this cadaveric image. So dissection, so the see here this cadaveric image. So muscles of the back of forearm, I would like to show you this cadaveric image. Okay, so very nicely you can appreciate actually when we are talking about, so see here these all muscles are on the back of the forearm in the extensor group, and the superficial category of these muscles which is shown very nicely, the lateral one, as you can see here, this is the brachioradialis. This is nicely shown you. This is the brachioradialis, okay, brachioradialis, BR. Then close to it, the lower part you can see just attached to brachioradialis, we have got extensor carpi radialis longus. Close to it the other, so this is ECRL and this is ECRB, okay. Now other than that you can very nicely appreciate also the extensor pollicis brevis, abductor extensor pollicis. The word pollicis means, what do you mean by the pollicis? So all these pollicis will be going towards the thumb. So extensor pollicis brevis and abductor pollicis brevis, extensor digitorum. So see here, these are together, the bulk of the muscle which is going towards the digit, these all are ED, extensor digitorum, and medial one, as you can see, the medial one is, this one is the ECU, extensor carpi ulnaris, and the small muscle shown on the posterior aspect of elbow joint, this is the Anconeus muscle. So in this diagram you can clearly identify the muscle. Very nicely you can identify here all the muscles, and with no of this black line to be used, it is clearly identified here. So my dear aspirants, if you will see these three muscles, that is extensor carpi radialis longus, extensor carpi radialis brevis and brachioradialis is more on the lateral aspect, and the superficial group more which is lying onto the posterior aspect, abductor pollicis longus, extensor pollicis brevis going towards the thumb, ulnaris is more medially towards the medial aspect, digitorum is going towards the fingers, and on the posterior aspect of elbow joint is the Anconeus. Posterior aspect of elbow joint is the Anconeus. Now let's appreciate the back muscle. More of the muscles here. So again from the lateral view you can see brachioradialis in this cadaveric image, extensor carpi radialis longus, and that of extensor carpi radialis brevis, very nicely. Okay, these three will always lie together. These three muscle always lies together, as you can see here, these three muscle. Other than that, you can see extensor carpi ulnaris is lying here medially, abductor pollicis longus and extensor pollicis brevis, superficial. So done with this. Now my dear aspirants, after seeing this cadaveric image, the next point which we have to know is the back muscles के लिए let's discuss each one muscle. So I will show you the diagrams and help you to understand the brachioradialis and all the muscles. So let's start with the first one. Okay. So let's start with this brachioradialis, brachioradialis. So my dear aspirants, this is an image in which you can see the humerus lower part. So you can clearly see in this image the brachioradialis muscle, and you can clearly appreciate that this brachioradialis muscle is arising from humerus lower lateral part. So what would be the origin? So brachioradialis is arising from the humerus, as you can clearly see in this image. It is arising from the humerus bone lower part, and to be more specific, it is arising from the upper 2/3 of lateral supracondylar ridge of humerus. Upper 2/3 of lateral supracondylar ridge of humerus. See here. So you can see here, brachioradialis muscle is arising from lateral supracondylar ridge of the humerus bone, as you can see in the diagram, and from here you can see this is the lateral supracondylar ridge. This muscle is traversing and going lower down, and it will insert at the level. So I am using this green color for the insertion level. It is going till the level. So you can clearly see this muscle is inserting at the level just above. So it is inserting onto which bone? It is inserting into which bone? It is inserting into the radius bone. To be more specific, the insertion, it is inserting into the radius bone, to be more specific, above radial stelloid process, above radial stelloid process. Okay, above radial stelloid process. Got it? Above radial stelloid process. Brachioradialis, is it clear? So I think this diagram is clearly showing you the origin and insertion of brachioradialis. Okay, brachioradialis origin and insertion can be appreciated. Now let me show you one more diagram here. So here also you can appreciate brachioradialis muscle originating from the supracondylar ridge of humerus and going just, ending just proximal to radial stelloid process. So origin and insertion is clear from the diagram. What remains is, what is the other? So before proceeding to the next MCQ, I would like to tell you about the nerve supply and the action. Basically, nerve supply is very easy. In one line, if I want you to tell the nerve supply of all extensor muscles, if I want to tell you the nerve supply of all extensor muscle, all the extensor, please note down this important point, all extensor muscles, all extensor muscles of forearm is getting innervation from, all extensor muscles of forearm is getting innervations from deep branch of radial nerve, deep branch of radial nerve. What is that called? As spin, posterior interosseous nerve, except two muscles. Which two muscles, dear? Brachioradialis and extensor carpi radialis longus. So these two muscles are directly getting innervation from radial nerve. So this is the key point to know the innervation of all extensor group of muscles. All extensor muscles of forearm is innervated by deep branch of radial nerve, that is posterior interosseous nerve, except the brachioradialis and extensor carpi radialis longus. This extensor carpi radialis longus and brachioradialis is getting directly innervation from radial nerve. If I talk about the action, so let me talk about the action of brachioradialis muscle. So please write down action of brachioradialis muscle. Action of brachioradialis muscle. When I am talking about the action of brachioradialis muscle, it flexes the elbow joint, it flexes the elbow joint and the other important position is that it is a muscle which is active in mid-prone position. Actually, it pronates the supinated. It's pronate the supinated forearm to mid-prone position. It's pronate. Okay. So this means supination. This means pronation. Okay. So what is this? This is supination and this is pronation. So it is pronating the supinated forearm to mid-prone position and it supinates the pronated forearm to mid-prone position. So this is the important action. So write down. It pronates the supinated forearm, it pronates the supinated forearm to mid-prone position, and it supinates the pronated forearm, the pronated forearm to mid-prone position. Done. So done with the action of brachioradialis. Let's move on to the other one. So we have done with the first muscle in this group. Let's move on to the other one, that is extensor carpi radialis longus. So when we have seen the cadaveric images also, there also we have appreciated that extensor carpi radialis longus and extensor carpi radialis brevis, they will be emerging below brachioradialis muscle. So yes, that is the thing. So let's see. So you can see close to the this muscle which you are seeing is ECRL, extensor carpi radialis longus muscle, lying very close. So here this muscle which you are seeing, this muscle, this will be the brachioradialis muscle. So here this is the brachioradialis muscle. So this muscle is also originating from supracondylar ridge of the humerus bone. I would like to show you this image. So see here, extensor carpi radialis longus. When we are talking about extensor carpi radialis longus muscle, so this extensor carpi radialis longus muscle, okay, so this is also originating from supracondylar, lateral supracondylar ridge of humerus bone, but it is from the lower 1/3 part. Upper 2/3 part से कौन सा muscle emerge out हो रहा है? From the lateral supracondylar ridge of humerus, upper 2/3 part, the muscle which is emerging is brachioradialis. If I talk about the lower part, that is the lower, if I talk about the lower part of the lateral supracondylar ridge, it is emerging out from the lower part is the extensor carpi radialis longus, which is taking origin from the lateral supracondylar humerus lower part. Now if I talk about the insertion, if I enlarge this image, so very nicely you can appreciate that this tendon, if I talk about this tendon, you can clearly see this, that this tendon is going till the level. It is not ending at the proximal aspect of radius bone, it is going towards the metacarpal bone, where it is going towards the dorsal surface of base of second metacarpal bone. So where it is inserting? It is inserting onto the base of second metacarpal bone. That is dorsal aspect. Which aspect? Dorsal aspect of the base of second metacarpal bone. So done with origin and insertion. So done with this. Now, so action together only we will know. So done with this. Now I want you to show the extensor carpi radialis brevis. So here you can see extensor carpi radialis brevis muscle. This is the extensor carpi radialis brevis muscle. So here you can see this one, extensor carpi radialis brevis, just lower to extensor carpi radialis longus we have got. If you will see, this is lying just lower to extensor carpi radialis longus and brachioradialis muscle. Okay, lower to it we have got ECRB, and this extensor carpi radialis brevis, as I told you, it is originating from common extensor origin. So you can see this diagram where you can appreciate the extensor carpi radialis brevis is originating from the humerus bone. That which part? Lateral epicondyle of humerus bone. It is originating from lateral epicondyle of the humerus bone. It is originating from lateral epicondyle of the humerus bone, that is common extensor origin. Common extensor origin. What about the insertion, dear? If you will see, this is the metacarpal bone and it is inserting. If you will see, it is inserting here. It is also inserting here. It is inserting here. As you can see, it is going towards the third metacarpal. So where it is inserting? Its insertion point is onto the dorsal aspect of third metacarpal, dorsal surface of third metacarpal. It is inserting onto the dorsal aspect of third metacarpal bone, dorsal aspect of third metacarpal bone. Clear? Now let's talk about nerve supply is already known. Let's talk about its action. So let's talk about the action of extensor carpi radialis longus and extensor carpi radialis brevis together. Action of ECRL and ECRB. So together I want to tell the action because both are causing the same action. So when the extensor carpi radialis longus and brevis is acting along with extensor carpi ulnaris, together they will cause which action? Together they will cause extension of wrist. So no doubt, when the extensor carpi radialis longus and brevis is acting together, they will cause extension of the wrist. And when extensor carpi radialis longus and extensor carpi radialis brevis is acting, longus means long and brevis means short. It is Ravi Kumar, it is due to length. Okay, it is not superficial and deep. It is due to the length. Okay, longus, extensor carpi radialis longus is originating from lateral. It is originating from humerus bone, lateral supracondylar ridge, and inserting onto the second metacarpal. But when you will see the brevis, it is originating from lateral epicondyle, common extensor origin, and going towards the third metacarpal. So length of longus is more than that of brevis. Short is brevis. Now extensor carpi radialis longus and extensor carpi radialis brevis, when acting together with FCR, that is flexor carpi radialis, this will cause abduction of wrist. This will cause which action? It will cause abduction of wrist. This is cause abduction of the wrist. Now let's move on to the next MCQ, next muscle, that is extensor digitorum. Extensor digitorum. Now let me again enlarge this diagram. So very nicely you can appreciate that this is a humerus bone. So extensor digitorum, it is also originating from epicondyle, lateral epicondyle. So origin is from the lateral epicondyle of the humerus, common extensor origin. What about insertion? So if you will see the insertion point, you can see here it is inserting, forming 4 tendons for the medial 4 fingers, and it is inserting where? What it is inserting into the distal phalanx. Okay, so extensor digitorum muscle is giving rise to 4 tendons. Okay, and by the means of it forms extensor expansion and it insert onto the dorsum aspect of the middle and terminal phalanx. In case of flexor muscle, we have got insertion of flexor digitorum superficialis in the middle phalanx and insertion of flexor digitorum profundus on the distal phalanx. But here that is not the case. Here we have got just one extensor, that is extensor digitorum, that is inserting both on the middle phalanx of the digits and the distal phalanx of the medial 4 digits. So write down insertion. When we are talking about the insertion of extensor digitorum, I will, after explaining, I will also come up with the MCQs. Okay, muscles 1 or 2, they ask questions from the muscles also. Okay, don't worry. So let's come on to the extensor digitorum. So extensor digitorum insertion. Actually, ortho question, surgery question, all are related to anatomy. So it is important that you should have a precise knowledge of the muscles of extensor region also. Now, insertion of extensor digitorum, it give rise to 4 tendons for medial 4 digits. Okay, by extensor expansion, by the mode of extensor expansion, these muscles are inserted into the dorsum of middle and distal phalanx, of the digit, middle and distal phalanx of the medial 4 finger digits. Got it? This is the insertion. All the topics, it's the choice. So we know that all the anatomy topics is correlated. So the benefit of studying anatomy is that you can solve also the question of scanning, eye, ENT, ortho, surgery and anatomy. So that is the thing. It is correlated with other subject also. So precise knowledge is important. If you have got a time of 1 year and more than that, so you can have, if you have got less time of 1 or 2 months, so we can go with quick revision like 100 MCQ series which I am taking. Okay. If you have a time of more, what I told you, Unacademy Future Doctor is conceptual and theory based sessions will be more, few MCQ sessions followed by, but Let's Crack NEET PG Unacademy Special and Plus course is of competition. So this is conceptual study, so that is important. So let's move on to the next. Now see here also you can appreciate the extensor digitorum muscle. Again you can see this is the extensor digitorum muscle, and these all digitorum muscle, as you can see, is forming the tendons and getting attached to the terminal phalanx and middle phalanx both. Okay, so that means it is attaching to both middle and that of terminal phalanx of the dorsum aspect of the digit. In case of when we are talking about so very clearly you can see it is diverges and it is not only attaching to the middle phalanx but also onto the terminal or distal phalanx. Okay. Now, what is the action? So, nerve supply we have already done. Now, let's talk about the action of extensor digitorum, ED for extensor digitorum. The action is it extends the medial 4 digit and it also helps in extension of the wrist. It also helps in extension of wrist. Okay. Now let's move on to the next one, extensor digiti minimi. Extensor digiti minimi. So if you appreciate it, what you can appreciate, these are, so this muscle outline. Okay. So the session is going to end in another 5 to, so we will continue tomorrow also the remaining part, don't worry. See here, this is extensor digitorum. So you can see here, this is the extensor digitorum muscle and here these are the tendons. So just medial to extensor digitorum muscle, the tendon which you are seeing here, this will be, this is the extensor digiti minimi tendon which is lying medial to the extensor digitorum tendon. So it is also originating. So here you can see, if you will see extensor digiti minimi, it is again originating from the common extensor origin, common extensor origin, and that common extensor origin is from the lateral epicondyle, and if you will see its insertion, so if you will see its insertion, it is inserting towards the, if you will see its insertion, it is inserting towards the dorsum of middle and terminal phalanx for the little finger. So it is inserting into the little finger middle and distal phalanx, both in the middle and distal phalanx. Okay, both in the middle and distal phalanx. Got it? So what about the action, dear? What about the action? When I am talking about action, so action will be, it extends the little finger and also extends the wrist. Also it extends the wrist. So don't worry, we will cover up the superficial muscle today and deep muscles of extensor compartment. Tomorrow a small session I will take. Now extensor ulnaris. So we have got just extensor ulnaris and that of Anconeus muscle, two muscles in the list of superficial groups. So I will complete that and then we can complete the deep muscles of extensor compartment tomorrow. So let's see here. When I am talking, this is ECU, extensor carpi ulnaris muscle, which is shown to you. It is also originating from common extensor origin. To be more specific, it originates from the upper 2/3 of the posterior border of ulna along with the FCU and FDP. So it is originating from the ulna bone. So see here, if you will see, this is the extensor carpi ulnaris. This extensor carpi ulnaris is originating from the lateral epicondyle of humerus, that is common extensor origin, that is common extensor. Not only this, it also originates from which bone? You can see here, this is the ulna bone and it is also originating from the posterior border of ulna. Posterior border of ulna. If you remember today's session, I have told you flexor carpi ulnaris and flexor digitorum profundus also originates from the posterior border of ulna, along with it extensor carpi ulnaris originate. And where is it inserting? As you can see, it is inserting into the base of 5th metacarpal. It is inserting till the base of 5th metacarpal. It is inserting till the base of 5th metacarpal, as you can see here. Base of 5th metacarpal, which is shown in the diagram. Now if I talk about its action, so you can see here, if I talk about the action of extensor carpi ulnaris, ECU, if I talk about its action, so when extensor carpi ulnaris is acting along with ECRL and ECRB, as I told you, it is causing which action? It is causing extension of wrist. When ECU is acting along with FCU, what does it cause? It causes adduction of the wrist. It will cause adduction of the wrist. When ECU is acting along with FCU, it can cause adduction of the wrist. Now, okay. So one more muscle is supinate. I also want to once more tell you that 100 anatomy MCQ series is starting from tomorrow. Okay, once more tomorrow, and this is NEET PG 2022 examination. So competitive examination NEET PG 2022. All those who are interested can join me on Thursday, Friday and Saturday session. 6 PM session on Let's Crack NEET PG YouTube channel. 7 PM Unacademy free platform. So this is the whole for all the 3 days. So Thursday, Friday and Saturday, 6 PM session on Let's Crack NEET PG YouTube channel, 7 PM session on Unacademy free platform. So this session will be of 100 most important anatomy MCQs to be done before the examination. So all of you should please do join. And my dear aspirants, I would also like to tell you about the last muscle, that is the Anconeus muscle. So let's talk about the Anconeus muscle. The last muscle of this group is the Anconeus muscle. Got it? So now I would like to enlarge this image, and this small muscle which is shown to you is the Anconeus muscle. Okay. Okay, this is the small muscle which is seen. This is the Anconeus muscle. Now, Anconeus muscle is originating from the back of, as you can see this this diagram. So, this muscle Anconeus, as very clearly you can appreciate in this image, that this is the elbow joint and the origin of Anconeus muscle. What is the origin of Anconeus muscle? It is originating from the back of lateral epicondyle and lateral side of olecranon process of ulna. So what you can see, you can also appreciate olecranon process of ulna in this diagram. So this is the olecranon process. So also from olecranon process and from the back of lateral epicondyle of humerus it is originating, and where is it inserting? You can see here it is inserting onto the lateral side of olecranon process. So it is inserting onto the posterior surface of olecranon process of ulna. So it is inserting on the posterior surface of ulna. It is inserting onto the posterior aspect of ulna, as you can see. So it's a very small muscle. So you can say it's a very small muscle lying on the posterior aspect of elbow joint. Next come its nerve supply. So to be particular, if I talk about Anconeus muscle, when we talk about Anconeus muscle nerve supply, this small Anconeus muscle which is lying on the posterior aspect of elbow joint, it is getting innervation from nerve to Anconeus muscle, and this nerve to Anconeus muscle is a branch of radial nerve which is given in the level of spiral groove. Where is the spiral groove lying? The spiral groove or radial groove is lying on the posterior aspect of the shaft of humerus bone. Other than that, what is the action of Anconeus muscle? So when we are talking about the action of Anconeus muscle, the action is it is a weak extensor of elbow joint. It also mixes up with the fibers of triceps muscle, and it also stabilizes the elbow joint. The other action is it stabilizes the elbow joint, and how it is stabilizing the elbow joint? It is tensioning the fibrous capsule of elbow joint, and it is preventing the impingement of the joint capsule when there is forceful extension. So it is also stabilizing the elbow joint, and it is causing weak extension of elbow joint. These are the two important actions of Anconeus muscle. Okay. So yes, before ending, so we will complete deep muscle tomorrow. Don't worry, deep muscle will be completed tomorrow. Okay, because many of the students are exhausted. So yes, and from tomorrow starting series of Thursday, Friday and Saturday, what is this? This is 100 MCQ session targeting NEET PG 2022 examination. Use the code ANAT10 and do present live for this session. This will be highly beneficial, my dear aspirants. Okay, session, timing, link and on which platform? 6 p.m. sessions are on YouTube, Let's Crack NEET PG, and 7 p.m. is on Unacademy free platform. The NEET PG free calendar test series till 12th March it is shown. Till 12th March this is discussed, and use the code ANAT10 to enroll and get the benefit of this free test. Other than that, this is the pricing detail, and the offer is valid till today, that is 9th of March, and you can see here the free offers are of 1 month, 2 months, 4 months and 6 months is given to you. You can use the code ANAT10 and get an extra discount of 10% by using the code ANAT10. Now this is the pricing detail. Have a comparison and then decide to take the subscription, which will be highly beneficial. So all the best. Thank you so much. We will again meet with the upcoming sessions, and do join and do like, subscribe the Unacademy Future Doctor platform. All the best. Keep studying. Thank you so much. Thanks my dear aspirants. Thank you so much. We will meet with the next session. Thank you so much. Thanks dear.